Good evening, everyone. Happy Diwali to all of you. Wishing you a very happy, healthy, prosperous new year. This is a season of festival, and today we have arranged this program with our academic partner, Sun Senora, on the occasion of World Prematurity Month. 17th November जो है that is World Prematurity Day. So I am Dr. Vaishali Chavan. I am Director Saanvi Clinic and Director at Sahyadri Super Specialty Hospital, hadapsar, Pune. I am a senior gynecologist. I am also a chairperson Perinatology Committee, FOXY. So today's program is more or less a program on social awareness about what is preterm labor, what is prematurity, prematurity का मतलब क्या है, and when the baby is born, a premature baby, what all complications can happen, what is the risk of preterm labor, what is the risk to the baby. So today I would like to talk to you shortly about that. So many congratulations to all the pregnant girls who are listening to me. Motherhood indeed is a beautiful experience. It is, I think, the relationship between a mother and a child is the world's most beautiful and special relationship. So I wish you all a very healthy pregnancy. If mother is healthy, then obviously the baby is going to be healthy. So before we go to what is preterm labor, prematurity, we should know that it is very important कि आप आपका during entire pregnancy पूरी तरह से ख्याल रखें, and what are the basic things that you should take care of so that there is no complication. We as gynecologists advise routine antenatal checkup. एंटीनेटल चेकअप यानी क्या? रूटीन केयर, रूटीन चेकअप ड्यूरिंग प्रेगनेंसी इज नोन एज एंटीनेटल चेकअप. इस चेकअप में minimum 5 to 10 visits over 9 months is very essential. During these checkups, we come to know कि whether ये patient it is normal pregnancy or this patient has high risk pregnancy. Now, what do you mean by high risk pregnancy? हाई रिस्क में आ जाता है प्री टर्म लेबर, वक्त से पहले डिलीवरी होना, उसे कहते हैं प्री टर्म लेबर, प्रीमेच्योरिटी. सो हाई रिस्क प्रीमेच्योर डिलीवरी बिलोंग्स टू हाई रिस्क कैटेगरी. एनी पेशेंट जिनका पहले प्रीमेच्योर डिलीवरी हो चुका है, she is highly she is very likely to go again into preterm labor. जिनका spontaneous abortion हो चुके, 2 abortions or more, then these patients are also likely to go into प्रीमेच्योर प्रीटर्म लेबर. हाई रिस्क प्रेगनेंसी में और क्या आता है? जिनको हाई ब्लड प्रेशर है, डायबिटीज है, हार्ट डिजीज, किडनी डिजीज, ब्लड डिसऑर्डर्स, एनीमिया. एनीमिया मीन्स हीमोग्लोबिन कम होना. So all these things come under high risk category. What do you mean by term and preterm labor? Any delivery which occurs 37 weeks पहले जो डिलीवरी होती है, that is known as preterm delivery. Delivery which occurs between 37 to 40 weeks is a term delivery. Human baby should be born before 40 weeks of pregnancy. So any delivery born before 37 weeks of pregnancy is premature delivery. Why are we worried? Premature delivery होने से क्या होता है? Premature delivery होने से what happens is the baby is premature. The baby's lungs are not developed. As long as the baby is inside the mother's uterus, baby can breathe, can if baby is doing good. But agar premature baby comes out in the world, in the routine atmosphere, this baby has difficulty in breathing outside. Baby goes into something known as respiratory distress syndrome. So for a premature baby, the lungs are not really well formed. जो surfactant level कहते हैं, which matures the lungs, जिससे air entry and outlet is maintained, oxygenation of the lungs occurs. That surfactant is less. So premature baby, you must have seen कि अगर preterm delivery होती है, तो that baby ends up in NICU. बेबी के जो स्पेशलिस्ट होते हैं, दे आर नोन एज नियोनेटोलॉजिस्ट. द नियोनेटोलॉजिस्ट टेक्स केयर ऑफ प्रीटर्म बेबी. ना हाउ मच इज द प्रीमेच्योरिटी? अगर बेबी 34 वीक्स टू 37 वीक्स में बॉर्न हुआ हो, So again, this is a good baby. The complication is less. Such a baby may stay in NICU for 1 or 2 days and this baby recovers and goes home. But jitna baby premature ho, suppose a 28 weeks baby delivers, a woman delivers at 28 weeks, just end of 7th month, then this is a very tiny baby, not even 1 kg baby. And then this baby has to go through a long, hard stay in NICU. उसे ऑक्सीजन दिया जाता है, लंग मैच्योरिटी के लिए सर्फैक्टेंट देते हैं, एंटीबायोटिक्स, कभी कभी दिस बेबी कैन बी पुट ऑन वेंटिलेटर. अगर बेबी के लंग्स फंक्शन नहीं कर रहे हैं तो वेंटिलेटर इज अ मशीन, आर्टिफिशियल लंग्स जिसे कहते हैं. सो दिस बेबीज में नीड वेंटिलेटर्स. Sometimes these babies come out, of course. NICU may babies as less as 800, 900 grams babies also can go home. But it is a long, long, long journey. और ये प्रीमेच्योरिटी का जर्नी जो है, it is a big, big burden, not only for the baby who's fighting for the life, but also for the family. It is highly stressful. Baby ka 1 month, 2 months stay in the NICU, and emotional burden, emotional stress, financial burden. So that is why we are talking about it today, to create the awareness that we should prevent preterm births, we should prevent premature births, and we should prevent this prematurity as a whole. As doctors, we take care of these high risk patients and we put them on medicines, we give them advice, we take care of them. But for you girls out there who want to know that what are the high risk factors, who are these women who are likely to go into preterm labor, what are the high risk factors, and how can I prevent the preterm labor? How can I keep myself safe? Ki I should not deliver prematurely, so that my baby remains safe. So these are the few things which we are going to talk about in detail. So initially I was talking to you about antenatal care. During antenatal care, we usually do sonography, blood tests. We required sonography जो रहती है 11 to 13, initial 6 to 8 weeks, then 11 to 13 weeks में for NT scan. उसी समय we also do one more blood test called double marker to rule out Down syndrome, Edwards syndrome. Main जो sonography होती है, that is anomaly scan, which is a very important sonography, should never be missed. 18 to 20 weeks of pregnancy, in which each and every organ of the baby is seen, imaging is done to diagnose any anomalies. Then again at 24 weeks, fetal 2D echo is done. Baby के heart के chambers कैसे है, valves कैसे है, and then every, for a normal patient, every 6 to 8 weeks sonography is advised. 32 weeks later, ultrasound Doppler is advised, that how much is the blood flowing towards the baby, is there resistance to the blood flow to the baby, and how baby is doing. We also advise vaccination, जैसे कि injection tetanus, swine flu injection, and also Tdap injection. So these are the mandatory vaccines which we advise during the pregnancy. So talking about preterm labor, how what are the high risk factors? Now let us see, the common high risk factors are age. अगर pregnant lady का age is less than 17 years of age or more than 35 years of age, she is at high risk for preterm delivery. Obesity or underweight, अगर वजन ज़्यादा हो, then again she is at high risk for preterm labor. Weight is less, underweight, BMI is low, again she is at risk for preterm birth. Habits like smoking, alcohol, drugs, prescription drug abuse, unnecessary medication, इससे भी preterm birth होता है, premature labor होता है. Stress, tension, emotional stress, work pressure stress, all these things also lead to preterm labor. Sometimes in lower socioeconomic groups, malnutrition, malnourishment, खाना ठीक से नहीं, balanced diet नहीं, all these factors also contribute. There is some chunk of society where there is domestic violence. Yes, domestic violence leads to preterm birth. Domestic violence may be emotional domestic violence or physical domestic violence, but that is a major contributing factor to blood sugar, diabetes. अगर कोई diabetic हो तो then the infection rate also increases. So any kind of vaginal bacterial infection, urine infection, risk of preterm birth is more. Hypertension हो या any other chronic diseases जिसे हम कहते हैं, if a patient has any of these diseases, then the risk of preterm labor is definitely more. So what we advise is any of the people who belong to this category, like weight ज़्यादा है या कम या smoking, alcohol or stress, so our advice is that you take care of all this. This is known as prevention. Preconception means बच्चा रहने से पहले, before you become pregnant, you should plan and see that your health is in optimum condition. Obesity, underweight, alcohol, smoking, stress, all these factors should be corrected, and then you should go into pregnancy. Before pregnancy, we also advise कि folic acid, full white आप ले लीजिए 5 milligram of folic acid, three which you should start 3 months before pregnancy should be taken. This again helps the baby's neural tube development. So before pregnancy, अगर आप optimum health में हो, you are in your best of health and you have corrected all the underlying high risk factors, then your pregnancy is going to be very good. Uneventful pregnancy outcome is going to be good, and you are going to have a healthy full term baby. Other factors are twin pregnancy. Twin pregnancy means because of overextension of the uterus, there's risk of preterm labor. Or people who have had previous preterm birth, then they have very high risk of going into preterm birth again. Previous 2 or more spontaneous abortion, they again have a high risk of going into preterm labor. Yeah, जिनके cervix पे, mouth of uterus is known as cervix. If any kind of surgery is done on the cervix, then the mouth of the uterus is likely to open up. So these patients also are at high risk of going into preterm labor. Repeated vaginal infection, they again will go into preterm labor. So it is important to identify these high risk factors and then take accordingly steps of prevention of preterm birth. So during your antenatal checkup, we usually ask patients about all these conditions. Another important thing is that interval between two children should be minimum 18 months. Agar immediately you become pregnant, then the risk of preterm birth is again high. So recommended is interval between pregnancies should be at least 18 months, minimum 18 months. That is what is recommended. So when you come for a regular checkup to us, we diagnose that yes, this girl is likely to go into preterm labor. So we treat you accordingly so that we can avoid preterm birth. So awareness, knowing how your pregnancy is doing, knowing your medical condition is absolutely essential. During pregnancy, we always advise have good balanced nutrition, a lot of fresh vegetables, fruits, milk, lot of proteins, dal, sprouts. Anemia is another concern in our country. Hemoglobin, 80% of Indian women are anemic. The hemoglobin is less than 10 gram per cent. So increase your hemoglobin, include in your diet dates and jaggery, spinach, figs, all this will help you increase the hemoglobin. We also prescribe supplements, iron, calcium, protein powder. So whatever your doctor has prescribed, you should take it adequately. In earlier olden days, the food grains and the vegetables were fresh and there were no chemicals and pollutants. But today, unfortunately, we don't get that kind of nutrition in our food. So that is the reason if you have been prescribed multivitamins and iron and calcium, please do take it. Nowadays, we are exposed to a lot of pollution also. That again is a stress factor. And today's girls, they are working girls, they have maybe now because of Corona, they work from home. But the commuting, traveling, managing, even in these, even when they work from home, it is working plus managing the household, and if there's already a previous small child, managing the child. So today's girl is a multitasker. So there is a lot of stress involved. Reducing the stress and taking care of one's health is of utmost importance for a normal pregnancy. So when such a patient comes to us and we doubt, we have that suspicion that yes, she's high risk for preterm labor, then what, as gynecologists, what do? We counsel the patient, we advise her that reduce all these your stress factors, reduce these risk factors because of which you are likely to go into preterm birth. Take adequate rest, well balanced diet, sleep well. What is recommended is 8 hours of sleep at night and 2 hours in the afternoon. Avoid unnecessary stress and tensions. Be happy, stay happy. For those patients who really require, sometimes we have to put a stitch on the mouth of the uterus. This is known as cervical cerclage. How do we diagnose whether she needs a stitch or no? We do it by sonography. Between 16 to 24 weeks of pregnancy, we do a special sonography in which we look for the cervical length, and if the cervical length is less than 2.5 centimeter, and if this patient has had a previous history of premature birth, then this patient is the ideal candidate for putting in a cervical stitch. Is that the only treatment recommended? No. For such patients, we also prescribe medicines like progesterones. These progesterones can be oral tablets or gels or vaginal tablets, but progesterone is a hormone which again will prevent premature birth. If the patient has infection, then we treat the infection. If the patient has any associated high risk factors, diabetes, blood pressure, then we treat that so that she doesn't land up in any other complication. These patients, some of them like twin pregnancy or some who have very short cervix, we advise them bed rest. It is not mandatory for everyone to go on complete bed rest, but we advise limited activity. Complete bed rest is advised only for those patients who have placenta previa, the placenta is low or who have bleeding. Such patients advise complete bed rest, but otherwise restriction in the physical activity is advised. For normal pregnancy, we say you should have normal walking at least for 30 to 40 minutes every day. There are some exercises which are safe for a pregnant girl. They should do it on regular basis. But for a girl who is high risk to go into premature labor, for such a girl, we do not advise walking for 40 minutes and vigorous physical exercise. For such a high risk girl, for such a high risk patient, we advise restricted physical activity. Regular checkups, regular sonography will help us in assessing whether she is likely to go into preterm labor. Because we know premature birth means it is a huge burden, emotional, financial, economical, in every possible way, not only for the family but for the baby. And many a times when these babies are born premature, very, very early, 28 weeks, 30 weeks, then these babies develop neurological deficit. They could be problems in attaining milestones like reading, walking, talking. Even the mental disability can be there, physical disability can be there. So it is, of utmost importance that we prevent and we stop preterm births and we do the best possible for prevention of premature births. Many a time for these patients, whenever required, we give them tocolytic drugs. These are medicines which stop the contraction. We give them steroid injections, which helps in maturation of the fetal lungs. We give them injections like magnesium sulfate, which help for the brain membrane, cerebral membrane stabilization. Sometimes we have to give antibiotics. Sometimes girl comes to the labor room and she comes in emergency ward and pregnant girl and she says suddenly there's water leaking. I was sitting and there was gush of water and where I was sitting everything became wet. Where I was sitting the chair became wet and my clothes became wet and everything became wet. So when this girl comes with such a complaint, what does it mean? It means this is premature rupture of membranes. Premature means वक्त से पहले rupture of membrane. So before the patient goes in labor, if there is rupture of membranes, there is a bag of fluid around the baby. This fluid is called amniotic fluid, and if the bag opens prematurely, then all the amniotic fluid drains out. So sometimes such a patient comes with PROM, premature rupture of membranes, and if this occurs before 37 weeks of pregnancy, then we call it as PPROM, premature rupture of membrane. So this again is not very good. There is risk of infection not only to the mother, but risk of infection to the baby and going into sepsis and higher antibiotics. And then again, there is a long process and a long stay in the NICU. So these things can be avoided, these things can be prevented. What I have explained to you, please identify these high risk factors. Please prevent all these things. Take good care of yourself. If you can prevent preterm birth by for those girls who are planning pregnancy, by pre-pregnancy, pre-conception, counseling, consulting a gynecologist, starting with folic acid, reducing your weight, keeping yourself healthy, balanced diet, and if there are habits like smoking and alcohol, you need to stop that. During entire pregnancy, visit for regular antenatal checkups so that any risk of preterm birth we pick up and immediately we start on the patient on the treatment so that we can prevent preterm birth. If at all some patient delivers prematurely, then remember that you need a place to deliver, a hospital to deliver where there is a good NICU. NICU is neonatal ICU. It is ICU for the babies, where there is a neonatologist, there is a gynecologist, because it's a teamwork. So a preterm baby, preterm labor, preterm birth requires a team birth, and all these facilities should be available when there is a delivery of a preterm baby, because this baby needs lot of support. And if this baby gets the correct support, then this baby can recover and can go home. So I wish you all happy pregnancy, please take good care of yourself, and please deliver at term. Avoid all these high risk factors which are likely to put you at risk for preterm. So my best wishes to all of you. Thank you. If there are any questions, we will just see and then we will answer the questions. Yeah. There is a question about if I eat spicy food, will I get preterm birth? So, yeah, what we advise about diet is avoid during pregnancy, avoid spicy food, oily food, junk food. Sanmophone. And just excuse me. Hello, hello. Sorry about that. And eat healthy. We all know what is healthy, what is unhealthy. So preferably try to eat healthy food, home cooked food, nutritious food. Junk food and all these cokes, pastries, maida, all that preferably don't eat. And that goes for all pregnancies, for any whether high risk or non high risk. It is always better to eat healthy, balanced diet. I think with this, we'll be ending the program and wish you all the best. Thank you. I would like to thank San Senora once again and thank you all for this patient hearing.